Hi, I'm Shanice, and my major is Health Sciences.
Hi, I'm Brianna, and my major is Human Development and Family Studies.
Hi, I'm Mariah, and my major is Human Development and Family Studies.
And I'm Samantha, and my major is Human Development and Family Studies. We did our diabetes project over genetics. We want to tell you a story about a girl named Sarah Smith who has diabetes and has found out how important her family's history is to finding out the problems with her health.
Once upon a time, there was a girl named Sarah Smith. She's a sophomore at Clinton High School. She is a star tennis player and enjoys hanging out with friends and shopping.
One particular day, Sarah doesn't feel like herself. She doesn't think anything of it and continues on her day as she prepares for a presentation in her history class at school.
While presenting a presentation on World War II, Sarah starts to feel dizzy. She tries to catch herself on the counter behind her. Her teacher then instructs her to go and see the nurse.
As Sarah is sitting outside the nurse's office, she sits in anxiety and waits for the nurse to explain to her what may be going on with her health. The nurse then calls her parents and believes it's best that Sarah goes home to rest.
Sarah sits and explains to her parents the symptoms that she has been experiencing. She tells them how she has been dizzy, weak, very thirsty, and has lost a few pounds in just 1 week.
Mr. and Mrs. Smith are confused and are not sure what is going on with their daughter's health. They suggest that they have a family meeting to discuss their family history.
The Smith family is in the living room to discuss their family history with Sarah. Sarah finds out that diabetes runs in her dad's side of the family. After a long family discussion, the Smith family comes to a conclusion that it is best that Sarah goes to see a doctor.
Sarah explains to the doctor the symptoms she has been having and how she fainted in class during her presentation. The doctor does a quick physical exam to see if there are any physical complications she may have.
Sarah's mom begins to explain to the doctor the family history of diabetes that runs on her dad's side. The doctor then has Sarah transfer rooms to have tests run on her so she can receive answers.
The doctor has Sarah lay down on the hospital bed and gathers blood from Sarah in order to run tests and analyze possible diseases she may have.
After running blood tests on Sarah, the doctor explains that the test results will take a week to come in. He then schedules a time for Sarah and her mom to come in and discuss the results of the tests that were done on her.
1 week later!
Sarah came back for her results only to find out that she has type 1 diabetes, which is the same disease that runs on her dad's side of the family. The doctor then gives Sarah the resources she needs in order to get her health back to normal.
2 weeks later!
Since Sarah now has learned information about the condition she has, she is now more cautious about her lifestyle. She is still able to enjoy the things she loves most, which is her favorite sport, tennis.